A 55-year-old male with uncontrolled diabetes presents with acute onset double vision. On examination, the right eye is deviated, down and out, with associated ptosis and a dilated pupil. Which of the following functions is most likely preserved in this patient? The down and out position with ptosis and dilated pupil indicates a complete third nerve palsy. The lateral rectus is unopposed, supplied by sixth nerve causing abduction. The superior oblique by fourth nerve causes the downward component. A 35-year-old woman with a history of multiple sclerosis presents with horizontal diplopia. On exam, when she looks to the left, her right eye abducts slowly, while her left eye abducts with horizontal nystagmus. Convergence is intact. Where is the most likely location of the lesion? The patient has a right internuclear ophthalmoplegia. When looking left, the right adducting eye fails. The lesion is on the ipsilateral side of the adduction deficit. A 65-year-old woman reports severe, electric shock-like pain in her right lower gum and cheek. The pain is triggered by brushing her teeth or a cold wind. Her neurological exam is completely normal. Which cranial nerve is most likely affected, and by what mechanism? Trigeminal neuralgia involves fifth cranial nerve. The classic cause is vascular compression at the root entry zone, in the cerebellopontine angle, leading to focal demyelination and aphaptic transmission. The normal exam is key. Pain with no sensory loss or motor deficit rules out secondary causes. A 40-year-old healthy man woke up with an inability to close his left eye and drooping of the left mouth corner. He cannot raise his left eyebrow. He denies any arm or leg weakness. Which additional finding would most strongly support a diagnosis of Bell's palsy over an ischemic stroke? Bell's palsy is a peripheral lower motor neuron lesion of seventh cranial nerve, causing weakness of upper and lower face. Hyperacusis indicates involvement of the nerve to stapedius, which is unique to a peripheral lesion. A 30-year-old construction worker reports progressive hearing loss in his right ear. Rhinier test shows air conduction better than bone conduction on the right. Weber test lateralizes to the left. Where is the lesion? Weber lateralizes to the unaffected ear in sensorineural loss. Here, Weber towards left means the right ear has sensorineural loss. A 50-year-old smoker presents with hoarseness, dysphagia, and ipsilateral shoulder weakness. On exam, right shoulder droops and difficulty turning her head to the left noticed. The gag reflex is absent on the right. Which cranial nerves are involved? This is jugular foramen syndrome. Compression of Glossopharyngeal causes absent gag and dysphagia. Vagus causes hoarseness, and spinal accessory leads to shoulder droop. Weak head turn to contralateral side. A 45-year-old woman presents with bitemporal hemanopia. MRI reveals a pituitary macroadenoma, compressing the optic chiasm. Which of the following visual field defects would you expect if the lesion instead involved the left optic tract? The optic tract contains fibers from the ipsilateral temporal retina and contralateral nasal retina. A left optic tract lesion causes a right homonymous hemanopia. A 25-year-old man presents after a minor head injury. During a football game, he complains of vertical diplopia that worsens when he looks down and to the left. On exam, his head is tilted to the right shoulder. Which cranial nerve is most likely affected? Fourth cranial nerve innervates the superior oblique muscle, which depresses and intorts the eye. A left nerve palsy causes weakness of depression, in adduction called as vertical diplopia, worse on looking down and to the right. The patient adopts a head tilt toward the opposite shoulder, here, right tilt, to fuse images. A 60-year-old woman with a 10-year history of hypertension and diabetes presents with horizontal diplopia. On exam, she cannot abduct her left eye turned inward. Which of the following is the most likely localizing diagnosis? Sixth cranial nerve has the longest intracranial course. It is vulnerable to cavernous sinus lesions along with often with other nerves. Petrous apex, orbital apex, increased ICP, microvascular most common isolated painless palsy in older adults. A 72-year-old man presents with difficulty chewing and moving food in his mouth. On exam, the tongue deviates to the left on protrusion. But there is also left-sided tongue atrophy and fasciculations. Where is the lesion? Hypoglossal innervates all intrinsic and extrinsic tongue muscles except palatoglossus. Lower motor neuron lesion tongue deviates toward the side of the lesion. With atrophy and fasciculations, upper motor neuron lesion tongue deviates away from the lesion without atrophy or fasciculations. A 55-year-old man describes excruciating, sharp pain triggered by swallowing, coughing, or talking. The pain is localized to the back of the throat, tonsillar fossa, and inner ear. Neurologic exam is normal. Which of the following is true regarding this condition? This describes glossopharyngeal neuralgia, pain triggered by swallowing, coughing, or talking. Key difference from trigeminal neuralgia. This neuralgia can cause bradycardia, asystole, or syncope due to afferent fibers stimulating the vagal nucleus and vasovagal reflex. A 30-year-old woman with vertigo undergoes the head impulse test. The examiner rapidly turns the patient's head to the right. The patient's eyes initially move with the head, then make a corrective saccade back to the target. This abnormal result indicates the head impulse test assesses the vestibulo-ocular reflex. When the head is turned to the right horizontal semicircular canal and its afferent eighth cranial nerve should signal the brain to drive the eyes leftward at equal speed. In right peripheral vestibular loss, eyes are dragged to the right, then a corrective saccade back to target. A 50-year-old diabetic woman presents with right eye pain, proptosis, and chemosis. On exam, she has eye fixed in midline, ptosis, a fixed and dilated pupil, and numbness in the V1 distribution. The cornea is anesthetic. Which additional finding would you expect? Cavernous sinus syndrome affects third, fourth, and ophthalmic, maxillary branch and sixth cranial nerve. The corneal reflex afferent limb is trigeminal, and efferent is facial. Jaw deviation is spared because V3 does not run through the cavernous sinus. A 45-year-old man presents with right facial paralysis, both upper and lower face, decreased tear production leading to dry eye, hyperacusis, and loss of taste on the anterior two-thirds of the tongue. Vesicles are noted in the external auditory canal. Which of the following best localizes the lesion? A neurological disorder caused by the reactivation of the varicella zoster virus in the facial nerve, resulting in painful, fluid-filled blisters in or around one ear, severe ear pain, and same-sided facial paralysis. A 28-year-old woman with acute vision loss in her left eye. Pupils. Left pupil reacts sluggishly to direct light, but briskly to consensual light. Swinging flashlight test shows the left pupil dilates paradoxically. Which of the following is the most likely diagnosis? A relative afferent pupillary defect. Marcus Gunn pupil occurs in optic nerve lesions. The affected eye has reduced afferent input. Direct response is weak. Consensual response is normal. Swinging flashlight to bad eye make both pupils dilate, because less afferent signal reaches Edinger-Westphal nucleus.